Hey everyone, it's Dr. Sarah, and today we're diving into a topic that's incredibly important, yet often misunderstood: cardiac arrest in young people. We often think of heart problems as something that affects older adults, but the reality is that young people can be affected too. Throughout this video, we'll be taking a closer look at 10 shocking reasons why cardiac arrest can happen to young people. From genetic conditions to lifestyle factors, we'll break down each cause in a way that's easy to understand and provide you with actionable steps you can take to protect yourself and your loved ones. Remember, knowledge is power when it comes to your health. By understanding the risks and taking preventive measures, we can work together to save lives and ensure a brighter, healthier future for everyone. So, let's get started and shed some light on this critical topic. Our first stop takes us deep inside the blueprint of life itself: our genes. Some of us are born with a predisposition to certain heart conditions that, if left undetected, can increase the risk of cardiac arrest. One such condition is called hypertrophic cardiomyopathy, or HCM for short. In HCM, the muscle of the heart becomes abnormally thick, making it harder for the heart to pump blood effectively. Another condition, arrhythmogenic right ventricular cardiomyopathy, ARVC, affects the heart's rhythm, potentially leading to life-threatening irregular heartbeats. If you have a family history of heart disease, especially at a young age, it's crucial to talk to your doctor about getting screened. Early detection through genetic testing and regular checkups can make all the difference. IEDs.
Let's travel back in time, all the way to the moment we entered this world. Sometimes, babies are born with structural issues in their hearts, known as congenital heart defects. These defects can range from mild to severe and might not always present symptoms immediately. Some common congenital heart defects include holes in the heart's chambers or problems with the valves that control blood flow. Regular checkups, especially for newborns and infants, are vital in identifying and addressing these defects early on. With proper medical care, including surgery or medication, many individuals with congenital heart defects can live long and healthy lives. Remember, early detection is key.
In this chapter, we're shining a light on an often silent threat: myocarditis. Myocarditis is an inflammation of the heart muscle, often triggered by viral infections. Symptoms of myocarditis can be quite subtle, mimicking those of the flu, like fatigue, shortness of breath, and chest pain. This often makes it difficult to diagnose, but early detection and treatment are crucial. If you or someone you know experiences these symptoms, especially after a recent viral infection, it's essential to seek medical attention immediately. Prompt treatment with anti-inflammatory medications and antiviral drugs can help manage the inflammation and protect the heart from further damage.
Chapter 4: The Rhythm Disruptor. Long QT syndrome. Let's decode the electrical language of your heart and talk about long QT syndrome, or LQTS. In LQTS, there's a glitch in these electrical signals, causing the heart's rhythm to go haywire. This disruption can lead to a rapid, chaotic heartbeat known as arrhythmia, which can be life-threatening. If you have a family history of LQTS or have experienced fainting spells or seizures, especially during exercise or emotional stress, it's essential to talk to your doctor about getting tested. Early diagnosis is key, and with proper treatment, including medications and lifestyle modifications, individuals with LQTS can effectively manage their condition and live fulfilling lives.
Chapter 5: The Impact Zone, Commotio Cordis. Imagine this. A young athlete is struck in the chest by a fast-moving object, like a baseball or lacrosse ball, at just the wrong moment in their heartbeat. This sudden impact can disrupt the heart's electrical activity, leading to an irregular rhythm and, in some cases, cardiac arrest. It's a chilling reminder that even seemingly harmless blows to the chest can have severe consequences. Encouraging the use of protective gear, like chest protectors, in contact sports is crucial. Educating coaches, parents, and athletes about the importance of safe playing practices and recognizing the signs of commotio cordis can make all the difference. Remember, safety always comes first.
Chapter 6. The Hidden Dangers. Undiagnosed or misdiagnosed conditions. Sometimes, the most significant threats to our health are the ones hiding in plain sight. Some heart conditions don't always present clear symptoms, especially in their early stages. This can make them challenging to diagnose, potentially leading to missed opportunities for prevention and treatment. The key takeaway here is the importance of regular medical evaluations, especially for those involved in high-risk activities like competitive sports. Early detection can save lives.
Let's address the elephant in the room: drug abuse. The reality is, illicit drug use, even just once, can have devastating consequences for your heart. Certain drugs like cocaine and methamphetamine act as stimulants, causing the heart to race and blood pressure to skyrocket. This puts an enormous strain on the heart, increasing the risk of irregular heartbeats, heart attacks, and even cardiac arrest. Misusing prescription medications, like opioids or stimulants, can also disrupt the heart's delicate balance. By openly discussing the risks associated with drug use and promoting healthy coping mechanisms for stress and emotional challenges, we can empower individuals to make informed choices that protect their heart health.
Chapter 8. The Delicate Balance. Severe electrolyte imbalances. Our bodies function through a delicate dance of electrolytes, minerals like potassium, calcium, and magnesium that play a vital role in regulating our heartbeat. Severe electrolyte imbalances can occur due to various factors, including dehydration, excessive sweating, certain medical conditions, or even the use of certain medications. Maintaining a balanced diet, rich in fruits, vegetables, and electrolytes, and staying adequately hydrated can go a long way in preventing these imbalances. Keep your electrolytes in check for a healthy heart. Chapter 9. Pushing the limits. Extreme physical exertion. While regular physical activity is crucial for a healthy heart, extreme exertion, especially without proper conditioning, can sometimes backfire, putting undue stress on even the healthiest hearts. Suddenly pushing your body to its absolute limit, especially in extreme heat or without adequate hydration, can overwhelm your heart, leading to irregular heart rhythms, dehydration, and, in rare cases, cardiac events. The key here is to listen to your body and exercise within your limits. Gradual progression in exercise intensity, combined with regular health checkups, can help ensure you're pushing your limits safely and effectively. Chapter 10. The Silent Invader. Infections leading to sepsis. Sepsis is the body's extreme response to an infection, triggering a chain reaction that can damage multiple organs, including the heart. Sepsis can develop from any infection, from a minor cut to a serious pneumonia, and its symptoms can initially mimic those of the flu, making it challenging to diagnose in its early stages. Early detection and treatment are crucial in combating sepsis. If you or someone you know experiences persistent fever, chills, rapid breathing, or confusion, especially after an injury or infection, seek immediate medical attention. Early intervention can save lives. We've covered a lot of ground today, exploring 10 critical reasons why cardiac arrest can happen to young people. From genetic predispositions to lifestyle factors and underlying medical conditions, it's clear that this is a complex issue with no easy answers. But here's the good news. Knowledge is power. And by understanding the risks and taking preventive measures, we can make a difference. If you have any concerns about your heart health or a family history of heart disease, don't hesitate to reach out to your healthcare provider. Regular checkups, genetic testing if needed, and open communication with your doctor can be life-saving. By empowering ourselves with knowledge and taking action, we can create a brighter, healthier future for generations to come.